Are you feeling overwhelmed by anxiety and wondering if menopause might be to blame? The hormonal shifts during this time can bring unexpected changes to your mental health, leaving you feeling anxious, on edge, and restless. In this video, we're diving deep into the link between menopause and anxiety, and more importantly, 3 things you can do to regain control. Hi, my name is Dr. Air. I'm a board-certified lifestyle psychiatrist. I'll tell you a quick story about Emma. At 49, anxious is not a word Emma would use to describe herself. However, one afternoon while driving home, her heart began to race uncontrollably. Her hands trembled and she was hit by a wave of dizziness. So, convinced she was having a heart attack, she pulled over, gasping for air. Her mind spiraled into a panic as her chest tightened. She called 911, terrified. At the ER, they told her it wasn't her heart, it was anxiety. But how? She had never felt anything like this before. She couldn't sleep that night, wondering what was happening to her body and mind. She had recently been told by her doctor she was perimenopausal, but she did not link this with the recent panic attack. Now, research shows that 40 to 50% of women going through menopause suffer from some form of mental health issue, with anxiety and depression being the most common. When you go through menopause, your ovaries stop releasing eggs and make little to no estrogen. However, in the 10 years or so before menopause, a period known as perimenopause, your hormone levels tend to fluctuate a lot. A patient once told me that perimenopause is like the weather before a storm. 1 minute it's calm and sunny, the next it's pouring rain, and you never quite know what to expect. Some researchers think these hormonal shifts cause anxiety more than the actual decline in estrogen. It is also believed that the fluctuations in estrogen affect brain chemicals like serotonin and GABA, which can contribute to anxiety. Also, hot flashes and night sweats can keep you awake at night, causing you to be sleep deprived. These can contribute to stress and anxiety. Some of the symptoms of menopause anxiety may include excessive worry, restlessness, feeling on edge, being easily fatigued, difficulty concentrating, irritability, muscle tension, sleep disturbance, and panic attacks. These can be distressing and you don't have to suffer from these symptoms. So let's talk about 3 ways to treat menopause anxiety. The first is lifestyle changes. The reason I talk about this first is because making simple lifestyle changes can significantly improve your anxiety without taking medications. You can start by eating healthier foods and cutting back on processed foods high in sugar. Consider eating more whole foods with fruits and vegetables in different colors. A rainbow of fresh fruits and vegetables will help provide the micronutrients needed to produce brain chemicals like dopamine, serotonin, and norepinephrine. These neurotransmitters ensure you have optimal brain functioning. So think of your brain like a high-performance car. Healthy whole foods are the premium fuel it needs to run smoothly, while sugary processed foods are like pouring in cheap gas that clogs the engine. Regular exercise is great for the body and mind. It releases endorphins, your body's natural stress-relieving chemicals. Physical activity also reduces tension, improves mood, boosts self-confidence, and distracts you from anxious thoughts. The American College of Lifestyle Medicine recommends 150 minutes of moderate intensity aerobic exercise per week. The key is to find exercise you enjoy, as this increases your likelihood of keeping up with it. Adequate sleep is essential for mental well-being, as poor sleep increases irritability and anxiety. So ensuring you have a consistent sleep schedule and enough sleep every night will enhance your mental health. The recommendation for adults is 7 to 8 hours. Reducing caffeine and alcohol intake is another crucial lifestyle modification, as both substances can worsen anxiety. Caffeine stimulates your nervous system and can cause rapid heart rate and jitteriness, which mimic anxiety. Also, alcohol can worsen your anxiety over time and disrupt your sleep patterns. All right, so the second way to treat menopause anxiety is using cognitive behavioral therapy, CBT. This is a type of talk therapy that teaches you how to reframe negative thoughts and change behaviors that may contribute to ongoing anxiety. It's like learning to be the driver of your own mind, taking control of the wheel and steering away from negative thoughts that lead to anxiety. CBT helps to manage stress, decrease the impact of hot flashes and night sweats, and improve sleep. Number three, medications. Effective drugs for treating anxiety are one, selective serotonin reuptake inhibitors, SSRIs. Prozac is an example. Two, serotonin norepinephrine reuptake inhibitors like Effexor. Three, benzodiazepines like Klonopin. Four, beta blockers like propranolol. And five, buspirone, also known as Buspar. Anxiety medications are like a thermostat for your mind, helping to regulate the temperature when your thoughts start to overheat. Like all medicines, side effects can occur, so following up with your doctor is essential. Hormone replacement therapy, HRT, may be recommended by your doctor if you have vasomotor symptoms like hot flashes and night sweats. HRT is usually offered as a combination of estrogen and progesterone. This treatment may get rid of your hot flashes and bring your anxiety levels back to baseline. Always follow up with your doctor to help with your mental disorders. But to learn more about anxiety treatment, watch this next video.